Most men over 60 believe that if something serious were growing inside your body, you would know. You would feel it. There would be a moment, unmistakable, undeniable, when something was clearly wrong. And so the smaller things get filed away. The trips to the bathroom at 2 a.m., the stream that isn't what it used to be, the low ache you've been carrying for months, getting older. Nothing to worry about, just age. I've sat across from men in my clinic who told me they had noticed something a year ago, sometimes longer, and they had done what most men do. They waited, they reasoned it away, and by the time they sat in my office, the window we needed had already closed. A man in his late 60s, waking 3 times a night for 14 months. Never mentioned it to anyone. Biopsy confirmed stage 3 prostate cancer. A man in his early 70s. Noticed blood in his urine once. Gone by afternoon. Waited 6 months. By the time he sat in my clinic, the cancer had already moved beyond the prostate. Here's what nobody tells men over 60 about how prostate cancer actually announces itself. It does not arrive with pain. It does not stop your life. It whispers through signs that feel like 100 other things. And most men have been trained by culture, by stoicism, to ignore whispers. My name is Dr. Sophie Martin. I'm a urologist with over 20 years in clinical practice. And today I'm going to give you the 13 early signs of prostate cancer that most men dismiss and that most doctors don't have time to explain. 13 signs, most of them silent, all of them worth knowing, because catching prostate cancer early doesn't just change the treatment, it changes everything. Think about a smoke detector with a dying battery. Every few hours, a small beep. Easy to silence, easy to walk past. Most people silence it 3 or 4 times before they finally do something. The beep was never the problem. The silence that followed it was, your prostate has been sending signals. Quiet ones. Easy to file under something else. They feel like other things because they travel through the same physical systems. The same tubes, the same nerves, the same muscles you have been using your entire life. That is exactly why they are easy to explain away, and exactly why they matter. The prostate wraps directly around the urethra, the tube that carries urine out of your body. Any growth, even small, changes how urine flows. It runs alongside the nerve bundles that control erection, and early prostate cancer almost never causes pain. That is not reassuring. That is the reason it gets missed. But here's the truth about what early detection means. Prostate cancer caught at stage 1 or stage 2 carries a near 100% 5-year survival rate, according to the American Cancer Society. Prostate cancer caught at stage 4 carries a 5-year survival rate of approximately 34%. Same disease. The only difference is when the conversation happened. The prostate speaks first through how you urinate. And this is why so many early signals get filed under age. They feel exactly like what getting older feels like. Sign 1. Frequent urination, especially at night. Waking 2, 3, 4 times consistently is not age. It is the prostate asking to be heard. Sign 2. A weak or interrupted urine stream. Here's what most men dismiss as just getting older. But the prostate is pressing against the urethra, and even small growth changes everything about how urine flows. Sign 3. Difficulty starting urination. You stand and you wait, you strain. The prostate is narrowing the channel the urine needs to pass through. Sign 4. The feeling that your bladder never fully empties. You finish and still feel full. Return within minutes. This is not a bladder problem. This is a prostate problem. Sign 5. Sudden, urgent need to urinate with no warning. The prostate is irritating the bladder wall, and it gets filed under overactive bladder or too much coffee. It is neither. Now, many of these urinary signs also appear in benign prostatic hyperplasia, BPH, a non-cancerous prostate enlargement affecting most men over 60. These signs do not confirm cancer. They confirm the need for a conversation with your doctor. Either way, that conversation is necessary. 5 urinary signs, all of them easy to explain away. None of them something you should. As the prostate grows, pain appears. Not dramatic pain, the quiet kind. The kind men carry without mentioning. Sign 6, burning or pain during urination. Low grade, consistent, easy to attribute to something else. In men over 60, this sign alone deserves a prostate conversation. Sign 7, discomfort or pain when sitting. A pressure in the pelvic region during extended sitting. The prostate sits between the bladder and rectum, and growth is felt exactly there. Sign 8, and this is the one I wish every man over 60 had been told years ago. Pain or stiffness in the lower back, hips, or upper thighs. When prostate cancer begins to affect bone, these are the first areas it touches. This sign combined with any urinary sign is a reason to see a urologist. Not next month. Soon. Has any man watching this been carrying lower back pain for months and never connected it to their prostate? Tell me in the comments. These next 3 signs are the ones men are least likely to mention to anyone, and they are some of the most important signals the prostate sends. Sign 9, new or worsening erectile dysfunction after 60. The nerve bundles controlling erection run directly alongside the prostate. New onset ED combined with any urinary sign deserves a prostate evaluation before any other explanation is accepted. Sign 10, painful ejaculation. This is the sign that gets ignored most often, and it shouldn't be. Pain during or after ejaculation is not a normal part of aging. It is the prostate signaling inflammation or abnormal tissue. Write it down. Bring it to your next appointment. Sign 11, decreased ejaculatory volume over months. Here's what I see in my clinic that breaks my heart. Men who noticed this for over a year and never raised it because nobody told them it was a prostate conversation. Before today, had you ever been told that erectile dysfunction could be an early signal for prostate health? Most men I sit across from had not. And that silence has consequences. These last 2 signs should never be dismissed. If you take nothing else from today, take this. Sign 12, blood in your urine, even once. Even a small amount. Even if it disappears. It demands a medical evaluation, not next week. Now, sign 13, and this is the most commonly ignored sign on this entire list, blood in semen. Men notice it, feel alarmed for a moment, then explain it away. Nothing else seems wrong, so it gets filed and never mentioned. I've sat across from men who noticed this and said nothing. I don't want that to be you. Blood in semen in a man over 60 is a direct signal from the prostate that something requires evaluation. It does not mean cancer, but it means something, and that something deserves a name. 2 signs, both involving blood, both involving a body that is trying very hard to be heard. Please listen to it. Write these down. Because knowing the signs is only the first step. Here is exactly what to do with that knowledge. If you recognize 3 or more of these signs, especially from more than one group, do not wait for your next routine appointment. Call your doctor this week. Ask specifically for a prostate evaluation. Use those exact words. Ask for 2 tests. A PSA blood test, prostate-specific antigen, and a digital rectal exam. Standard first-line screening. Neither takes more than a few minutes. Both could change everything. If your PSA comes back normal but symptoms persist, ask about PSA velocity, how fast that number is changing over time. A rising PSA, even within normal range, is clinically significant. And if you raise these concerns and they are dismissed without examination, ask for a referral to a urologist. A physician confident in prostate health will welcome your questions. If your concerns are waved away, Dr. Urinary, that response itself is a reason to seek a second opinion. These are not the actions of a hypochondriac. They are the actions of a man who understands that early detection is not anxiety. It is intelligence. 13 signs is a heavy list to carry. And if some of what I described today sounded familiar, that recognition can feel frightening. I am not going to minimize that, but I need you to hear what that fear is sitting next to. Prostate cancer caught at stage 1 or stage 2 carries a near 100% 5-year survival rate. Prostate cancer caught at stage 4 carries a 5-year survival rate of approximately 34%. Same disease. The only difference is when the conversation happened. The body is not giving up. It is sending signals. This video was about learning to hear them. What you do next is entirely in your hands. I want to tell you about a patient. I'll call him Robert. 69 years old, retired. A woodworking shop in his garage. The place he spent every morning. the place his grandson was learning to use the lathe, and he had been waking up 3 times a night for over a year. Stream getting weaker. He told himself it was age. He told no one else. He came to me for something unrelated. I asked the questions. He answered. His PSA came back elevated. Biopsy confirmed stage 2 prostate cancer. Early, contained, treatable. He looked at me across that desk and said, I kept thinking, who's going to finish teaching my grandson how to use the lathe? That was 2 years ago. Robert is back in his shop every morning. His grandson is getting very good with the lathe. That is what early detection looks like, not a statistic. A Saturday morning, a symptom is not a sentence, it is a signal, and a signal caught early enough is not the beginning of the end. It is the beginning of a conversation that could give you decades more. I can order the PSA test. I can read the biopsy result. I can sit across from you and give you everything medicine has to offer, but I cannot make you walk through the door. That step, the one that changes everything and belongs entirely to you. You know the signs now. You know the tests. You know the questions to ask. The only thing left is to ask them. A PSA test is just a number. But the decision to walk in and ask for it, that is the most powerful thing you will do for your health this year. 13 signs. Urinary changes, the prostate's earliest language, pain and stiffness, including signals that may involve bone. Sexual changes, the most dismissed conversation in men's health. And blood, in urine or in semen, a body trying very hard to be heard. Which of these have you been dismissing, and for how long? Tell me in the comments. And if there is a man in your life who needs to hear this, just send it. That one share could be the most important thing you do for someone you love today. Take care of yourselves. You deserve a doctor who asks the right questions. And now, you know exactly what the right questions are. Everything shared today is based on published clinical research and over 2 decades of patient care, but it is general information, not personal medical advice. Please bring what you've learned into a full conversation with your own doctor. That conversation, without delay, is exactly where early detection begins.